how are you today?
Good, you?
Good. My name is Caitlin Getchell, and I'm a student physical therapist at the University of St. Augustine. Before we begin our treatment today, can you please tell me your full name along with your date of birth?
Sure. Charlie Cleto, 02/19/1993.
Great. And can I check that on your wristband, please?
Yep.
Awesome. So I understand that you're here today because you've been experiencing low back pain along with muscle spasms. Is this accurate?
That's correct.
All right, so what I'd like to do today is a cold pack treatment. And what this is going to do is help reduce some of your pain along with the muscle spasms. But before we begin, I'd like to go over some contraindications that
Sure.
you might have. So are you aware of having cancer, Raynaud's disease, or peripheral vascular disease?
No.
No? Any vascular insufficiencies?
No.
Okay, great. And some precautions which we can look out for are any open wounds. And then if you're very old or very young, which you seem okay, so we can probably move on and proceed. Does this sound like something you'd like to do?
Yes.
All right, so some of the effects of the cold pack are decreased pain, and this is gonna happen through decreased nerve conduction velocity.
Okay.
And then decreased muscle spasm, which is gonna occur because of the decreased sensitivity of the muscle spindle afferent fibers.
Okay.
Layman's term, it's just gonna reduce your pain and muscle spasms.
Sure.
So before we begin, I'd like to have you jump on the table if that's all right.
Yeah.
And if you could remove your t-shirt and your sneakers and then lay on your stomach for
Okay.
me. Alright, and we're gonna place this pillow under your hips. That way we can neutralize your spine. Great. And is it okay if I tuck a towel into your pants?
Yes, that's fine.
Great. So before we begin, I'm going to go ahead and palpate the muscles just so
Okay.
we can see that the soft tissue seems all right. And then before we begin, on a scale of 0 to 10, 0 being no pain at all and 10 being the most excruciating pain, you have to go to the emergency room, what pain are you feeling?
I'm at about a 6.
About a 6, all right. And then we're gonna go ahead and inspect your skin to make sure that there's no open wounds, cuts, lacerations, or anything. And everything's looking good. So now we're gonna go ahead and check for sensation.
Okay.
So I'm gonna go ahead and swipe this cotton ball against your cheek. Is that okay?
Yep.
And then when you feel it, go ahead and say yes.
Okay. Yes. Yes. Yes.
All right, go ahead and close your eyes and do the same thing.
Yes. Yes. Yes.
Great, now keep your eyes closed.
Yes. 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 Yes.
Awesome. So now we're gonna go ahead and lie this cold pack on you. What we've done is we've put a pillowcase around the cold pack, and this is gonna help protect your skin. And then we've also made the pillowcase a little damp, and then this is gonna help enhance the cold and increase the conductivity.
Okay.
So I'm gonna go ahead. First thing I'm gonna do is lay this on for about 5 minutes. The total treatment's usually 20 to 30, but I wanna make sure since it's your first time that we reassess and make sure everything's okay.
Yeah.
Some of the sensations you should be feeling are first coldness, followed by burning, then aching, and then numbness.
Okay.
And then I'm also gonna go ahead and give you this call belt over to your right. And once I put this on, if you have any questions or you feel maybe uneasy, go ahead and ring this and I'll go ahead and come back and check.
Okay.
So we're gonna go place this. And I'm gonna set my timer for 5 minutes, and then I'll come back to assess you once that's over. Alright, so it's been 5 minutes. I'm gonna go ahead and take the cold pack off.
Okay.
We're gonna go ahead. Your skin looks great. There's no discoloration, so if it's okay with you, we're gonna go ahead and continue the treatment.
Sure.
And again, verbalize for me when you start feeling those sensations of cold, burning, aching, and numbness.
Okay. It's cold.
Okay?
It is burning, aching, and it is now numb.
Okay. So what we're gonna go ahead now and do is we're gonna reassess to make sure that you are numb. So when you feel the cotton ball, go ahead and say yes. Alright, and again, on a scale of 0 to 10, how would you rate your pain?
It's at a 0.
At a 0? Awesome. So some of the other treatments I might do with you are lie you on your back and do some trunk rotations.
Okay.
And then other than that, this treatment is all done. I'll go ahead and help you get up, okay?
Okay.